Hello, for those that don't know me, my name is Anne, and today I'll be talking to you about the biopharmaceutics and formulation of amoxicillin tablets. As I'm sure you're all well aware, amoxicillin is a beta-lactam antibiotic, and it's used to treat susceptible bacterial infections. Today I'll be talking about the tablet formulation of amoxicillin, and we'll take a look at the stability of this formulation, as well as the excipients we need to make it. I'll also look at the pharmacokinetics of amoxicillin and its absorption and clearance from the body. So, for oral formulation of amoxicillin to be successful, it needs to be able to be absorbed from the gut, that is, it needs to be able to cross biological membranes and reach the site of infection. If we take a look at the structure of amoxicillin, it has two ionizable groups, and both of these will be charged at physiological pH, including in the gut. It also has quite a number of hydrogen bond donors and acceptors, which I've highlighted for you here. So as we can see, for quite a small molecule, it's very polar, and it does have the two charged functional groups. So it'd be reasonable to expect that amoxicillin would have trouble penetrating a lipophilic molecule. So the real question is, just how is amoxicillin absorbed? The answer to this question is that amoxicillin is absorbed by a carrier-mediated transport process, specifically the PEP-T1 oligopeptide transporter. Now, the diagram at the top of this slide just shows how an oligopeptide normally would interact with the transporter in order to be transported across the membrane. Our friend amoxicillin mimics the structure of an oligopeptide, and it also has the necessary functional groups to interact with the transporter and be transported across the membrane. So these include the amine group, carbonyl, and the carboxylic acid, and all of these are in the right location to interact with the transporter. So the amoxicillin is absorbed by the transporter-mediated process, and this is why it has good bioavailability and we can use it as a tablet formulation. The other pharmacokinetic consideration we really need to look into with amoxicillin is its clearance. Amoxicillin is normally renally cleared with quite a short half-life of just 61.3 minutes. This is quite, as I said, it's quite short, and just to put it into perspective, normally we'd consider a drug to be completely cleared from the body within about 5 to 6 half-lives. So when you consider that amoxicillin tablets are usually given twice a day, it just doesn't seem to add up with that short half-life. Now, the important thing with amoxicillin is not what its plasma concentration is at any one point in time, but how long that plasma concentration remains above the minimum inhibitory concentration for the bacteria. As long as this occurs for more than 40 to 50% of the dosing interval, amoxicillin will be effective. Now, the biggest stability concern for amoxicillin tablets is the self-aminolysis reaction. This occurs when the nitrogen from one amoxicillin molecule nucleophilically attacks the carbonyl of another one, and that leads to opening of the beta-lactam ring and formation of an inactive dimer, as you can see here. Now, the self-aminolysis reaction can only occur in solution, but this can occur on tablets in humid conditions where you can get the formation of a water layer on the tablets that can dissolve the amoxicillin. This can also be promoted by some of the excipients in the tablet formation, which are hygroscopic, that is, they can absorb water. In order to minimise this degradation process, amoxicillin is formulated as amoxicillin trihydrate, which is poorly soluble, so therefore if a water layer does form on the tablet, the concentration of amoxicillin in there is quite low to minimise the degradation. The amoxicillin tablets are also packaged in a blister strip, which can help to exclude the water. The self-aminolysis reaction can be a concern in the manufacturing process. Most tablets are manufactured using a wet granulation process, and that's where the drug powder is wetted to form granules, and manufacturers like granules because they flow better and compress better than powders. So amoxicillin would need to use a solvent other than water to wet the powder, just to make sure that the degradation doesn't occur during the manufacturing. In terms of clinical performance, oral formulations like the amoxicillin tablets are quite inexpensive to manufacture and administer, and they're less invasive than parenteral formulations. The amoxicillin tablets are coated to help with swallowing, but they are quite big tablets. They contain 1 gram of amoxicillin as well as excipients on top of this, so they can be too big for patients to swallow. As well as this, we need to keep in mind that the oral route can be unsuitable for some patients, such as those that are unconscious or those that have vomiting or diarrhea, and these patients should ideally receive the injection of amoxicillin instead. Amoxicillin tablets have a higher dose than capsules, and this enables them to be given less frequently, just twice a day, and this can help with patient adherence. Now, the problem with tablets is we can't give more precise doses than really 1 or half a tablet at a time, and when we need to give doses to children of amoxicillin, we calculate the dose based on their weight, so we really can't give them tablets. So now we'll just finish up with a look at some of the excipients in the amoxicillin tablets, starting with the coating. Hypomellose is a polymer used to form that film coating. As I mentioned before, it helps patients swallow, and it also can mask the taste of the tablets and protect the tablets from abrasion. Hypomellose is odourless and tasteless, which is ideal for something that's used as a film coating. Titanium dioxide is used to give the coating a nice white colour. Now, probably the most important excipient in the formulation would be sodium starch glycolate. This is a disintegrant. It helps break up the tablets in the gut, maximises the surface area available for dissolution, and therefore maximises absorption as well. Now, it's important for amoxicillin tablets because, as I mentioned before, they're formulated as amoxicillin trihydrate, which is poorly water soluble, so we really need to optimise the process of dissolution just to make sure that we get good absorption. Being a disintegrant, sodium starch glycolate does absorb water, and as I mentioned before, this can have issues with degradation of amoxicillin. Povidone is a binder that's used in the wet granulation process. It helps hold the granules together and also make sure that the tablets have sufficient strength after they're compressed. Microcrystalline cellulose also acts as a binder, but it's probably used mainly as a filler in the tablet formulation just to get the tablets up to the right size. Magnesium stearate is a lubricant. It's used to reduce the friction during tablet compression, so we avoid getting problems like you can see at the top of the slide of capping and fragmentation. It is quite a hydrophobic substance, so it does impair the penetration of water into the tablet, which can impair disintegration and dissolution. It also has an unpleasant taste, but hopefully the film can mask that. And the last excipient in the tablets is talc. Talc also has lubricant properties, but it acts as a gluidant, just helping the drug powder and the granules flow a bit better. So just to summarise the main points that we've covered in the discussion today, absorption of amoxicillin is facilitated by a carrier-mediated process, which means amoxicillin has a good enough bioavailability to be used to be administered orally. It has a reasonably long duration of action, although it has quite a short half-life. The main stability issues for the tablet formulation is the sulfur-aminolysis reaction, but this only really occurs when the humidity is high. And finally, we took a quick look at the excipients that you needed to facilitate the manufacture of the tablets and ensure good clinical performance. Thank you all very much for listening. I'll see you in class.